it's Bernadette. How are you? I am doing fantastic. I'm about to show you a couple of exercises for anybody that has some lower back pain or some low back issues, as long as you've been cleared by your physician to exercise, and it's nothing very serious. Some basic moves are the Superman or the Cupid or quadruped position on a stability ball, followed by some single leg reverse hyperextensions or leg lifts on the ball. Followed by the last one will be a pelvic tilt seated onto the ball. All these exercises should be done without any pain. If you feel or experience any low back pain while doing them, then stop doing them immediately. It would just be based on your form, and you just need to understand the exercise a little bit better before you perform it. Okay, so the first exercise will be a opposite arm, opposite leg lift with the ball placed right below the pelvis. You want to make sure the ball isn't too far up onto your upper abdomen. You don't want to feel it squeezing on your diaphragm. You want to be able to breathe. You want to feel like you're choking. It should be nice and steady right across your pelvis area here. Okay, what I'm going to explain to you next is your spinal cord, your scapular stability, which is your shoulder blades, and your pelvis stability, which are your hips, okay, as well as your core and the contraction of it and being able to breathe. So when I place this ball onto my hips, I'm going to come out and I'm going to be on all fours. Okay, from there, I'm going to make sure that my cervical spine, which is the back of your neck, is completely straight from the top of my neck to the bottom of my tailbone. So you don't want your neck to be cocked up like this, okay, as you're doing it, so you can look up across the room at something or the TV's on or something. You need to look straight down to the floor. All right, I'm going to explain all this before I do it so I can just perform it without speaking while I'm performing it, so I can try to show you good form. Okay, so I'm going to be looking straight down. My shoulders are going to run away from my neck. So you never want to be all like this. Okay, try to separate your neck, making it nice and long, putting it on stretch. Okay, pretend you're trying to get your shoulder blades back into your back pocket. As my hands are on the floor, my wrists are going to be right below my shoulders. Okay, so they're not going to be out in front of it. They're not going to be over here. They're not going to be way out here. So you can position all your joints stacked up upon each other. My pelvis, okay. You're going to make your pelvis a part of this ball. Okay, you're going to try to push it through the ball. So basically, you're going to tuck your tailbone under, and you're going to try to swallow this ball with your pelvis. I don't know how that just sounded, but okay, you're just going to really grab onto this ball at your pelvis and make it a part of it. You're going to crazy glue it to it. Okay, you're going to squeeze your glutes. So the way you should look and the way you're going to see me look is your starting position before we do any lifts is going to be steady, stable, contracted, engaged. Muscles, the right muscles engaged. Once you're all set with that, then you're ready to go. And you're going to move through the motion very slow and controlled, so you're not going to go through it too fast just to get your arm and leg up and back down quickly, because then you're missing the whole point of the exercise. This is a core stability exercise, and the idea is to use slow and controlled movements, okay, so we can really engage the right muscles of the core, the stabilizing muscles of the core, okay, and muscles in the back and the lower back. We really, really want to strengthen them. And by doing it, you need to feel them. You need to do it slow and controlled. Okay, your belly button, your core, you're engaging. You're pulling your belly button toward your spine. A good way to practice that before you even were to go on here is to inhale, let your tummy distend, or just let your stomach come all the way out as you inhale and through your nose, and as you exhale, that's when you want to contract your stomach, your abdominals, and pull it in towards your spine, and just hold it there. don't get so intense where you're like this, because then you can't breathe, okay? Keep it only in here, not in your chest, not in your shoulders. You're not using any part of your upper body to bring your belly button to your spine. It should stay in here. Okay, so what you do, you inhale and let your abdominals come out. Exhale. Hold on to that, and I can still breathe. Just keeping a little grip on that, okay? That's how you're going to draw it in before we start lifting. Okay, for beginners, as long as you're doing it with good form, you don't feel any pain, and the ball's not rocking all over the place. The idea is the ball is to stay steady. You want to maybe start with 10 reps, take a rest, and if you want to repeat for another set or two, that's fine, and eventually you can go up to 20 reps, as long as you have good form. Okay, so here we go. Bring the ball, bring one hand out. You may have to actually push the ball down under your pelvis. Okay. You don't want your feet to be too close together because you'll lose stability. When you first start, make it a little easy. Widen your feet, widen your hands a little bit, spread your fingers, okay, just until you get used to what is actually going on. Okay, so remember everything I said. I'm not going to do the motion looking up like this. Straight down, shoulders down, pelvis tucked. I'm attaching my pelvis to that wall, okay, squeezing my glutes, and from here, just going to raise. Yeah, it's tough. I'm getting it now. Oops. In between each raise, I reset. So watch what I do. Before I switch, I push my shoulder blades down again and I retuck my pelvis, because you do lose a little bit as you're doing the motion. Okay. All right. I don't know if this has anything to do with the fact that I did a bunch of these prior to making this video. In fact, I did this whole thing prior to making this video. So, I don't know, maybe I was a little fatigued from that too, but it isn't easy. It's a stability exercise as well, because you have this ball underneath you. Okay, so next will be just the lower body. Okay, so same idea. You're going to come down and make sure that ball is nice and steady under your pelvis. Okay. And now this is simply just the legs. Okay? Just the legs. Now, I'm just going to lift my head for a minute just to explain this to you, because I know that you only can really see my one leg here. Okay? I don't have a lot of room. I'm stuck in this little corner. I don't want you to try to lift your leg up like this. I do see a lot of people doing these things like this. That is not good for your spine. That's just not good, okay? Just go to the level of your body, as if you was, just lengthening your leg. See? No higher than my hip, okay? And that's all you're going to do. All right, for this, I'm just going to do one leg at a time, starting with the leg that you can C. Okay? All the same rules apply. Get ready, set, and just repeating. Every single time, I'm contracting that one butt cheek. Pressing my pelvis into the ball. Pushing my shoulder blades down. Keeping the back of my neck straight, long, looking straight down. I'm not using any other part of my body. Inhaling. Exhaling. I have good momentum. I'm not going too fast. I'll just do 2 more. You'll feel this in your butt as well. You'll start feeling it in that cheek. It will start getting nice and sour. Okay, and then you repeat the other side. You should not feel any neck pain either. If you do, just push your shoulder blades down again and keep your chin tucked and keep your shoulders out of your neck. If you start feeling anything in your back, just a slight something, just make sure your tummy, your belly button is contracted toward your spine. Make sure you